Doc, welcome to Radio Culture, iCulture TV.
Thank you.
And full
So how do
disclosure,
I address you, Ras or?
you see, interesting question because I was just about to go there. Full disclosure, I have to do that. Dr. Yeboah is a friend of mine, great friend of mine, way back from St. Peter's Secondary School. So, it's another Pescoba affair again. Thank you very much for making time with us, Doc.
You are welcome. Anytime.
All right. Okay, Doc. So let's start the discussion, Doc. At some point we invite you to have a fuller discussion because this is something that we cannot fit into in the context of a morning, like a stream show. It's just like 20 minutes or so. But I would like to speak to you at another time with more detail. But today, let's just touch on as much as we can, Doc. When we say geriatric health, generally speaking, what are we talking about?
So thank you for having me on the show. So geriatric health is simply just caring for elderly patients. And we are talking about people, initially it was people over the ages of 65 and above. I think it's in the Western world, they pegged it to the age of retirement. Most people in the Western world retire around 65. So, but now we have people living and working well into their 70s. So now there's a concept of healthy geriatric folks, which will be people from the ages of 65 to like 75. And then people older than 75 will be the normal geriatric folks. So it encompasses their health, their social needs, and everything that affects their health.
Does this include mental health?
It includes mental health.
Because that's where I want to go with you when we get to Ghana. So please continue.
Yes, it includes mental health. Actually, we have what we call the geriatric syndromes, and that includes apart from their physical health, the geriatric syndromes usually includes things like depression, dementia, incontinence, mobility issues, falls, weight loss, and believe it or not, food security. Because either they cannot prepare their own foods or they have no means of getting the right food to eat. So there is some food insecurity among elderly patients too.
So Doc, I know you are US board certified and you practice here in the US, right? So a lot of what you're saying, of course, apply to the United States. Now, I want us to move over to Ghana, right? And everything else that we're going to say, let's look at it within the context of that demographic that you defined for us in Ghana, right? Do you see a structure for taking care of people in that bracket at all in Ghana? Is there a support system? And I'm not talking about the support system, I'm talking about the medical area.
Yeah, so there are a few geriatricians in Ghana. One actually trained here, one was trained in Ghana, who are doing an amazing job in Ghana, considering that we don't have the setup to practice effective geriatrics. And what I mean by practicing effective geriatrics is you need a social worker, you need a physiotherapist or physiotherapist, you need some psychiatrists, you need nurses who are just primarily geriatric care nurses, you need nutritionists, you need so it's a team approach. So you need a lot of medical professionals to enhance the system to work. In Ghana, the care of older folks who heavily relied on a family, but things are shifting now because I can use my own parents-in-law as an example. They are in their 80s, but there's no family around them to help them, so they have to do things by themselves, right? So we don't really have those systems where we can, and if we do, it's usually privately funded. People pay nurses to help their old folks. People pay, other workers to help them with their day-to-day chores, like cleaning their homes, providing food for them.
That's
It's
right.
it's mainly privately funded. There's no real. I wouldn't. Over here, we have Medicare, Medicaid, which
That's right.
bear
That's right.
the responsibility of
And
this.
then there are programs like RAIN, which take food to older folks in their homes,
In their home.
already prepared food. That is right. They'll bring it to them so that they, and sometimes I had a neighbor back in the Bronx, Doc, who would share some of this food with us.
Oh
She had so much.
yes.
But they kept bringing her food that she couldn't even finish everything that they were bringing her. In Ghana, though, what are your recommendations for plugging something like that into our budget, into the politics that we're doing over there, so that we are not saying, oh yeah, we're Busian for so we're leaving everything on the Busian without looking very carefully at that demographic. I believe if we look at that demographic carefully, we will increase the age expectancy in Ghana. Do you agree?
Yes, I'm happy you touched on it. The first thing is recognition. So we have to recognize that there are folks who are old in the community who need the help of, and I think healthcare should be even here in the US. People say they don't like the government in their affairs, but it's mainly government that is spearheading the care and delivery of healthcare for people. So I think government has to be very involved in this, and we have to acknowledge that we have older folks in Ghana who do not have the family support that others do. So
do you see the opportunity for private investment, private involvement? That's investor involvement in that area. Is it?
Yes, I do see opportunity for that. For instance, when people are, when you and I, for instance, we are, if for some reason we get admitted to hospital, we can be discharged and the next day we can go about our duties, right? But for people over the ages of 70, 75, if they are discharged from hospital, they cannot go back immediately into their activities that their baseline, let's say their baseline, where they can do things that they used to do before they went to the hospital. Because it's said that when someone lies in a hospital bed for one day, they lose 15 hours of function. So and if you hospitalize someone for 10 days, that person has lost like 150 hours of what function. So they don't have the strength. They will need some form of transitional care. So we need transitional care homes in Ghana where people can go there and get a physical therapy or physiotherapy that they need to get their strength back, to go back home to their normal lives.
How about insurance? Do you see opportunity there for privately funded health insurance, for instance?
Yeah, I think the privately funded health insurance can go into this space too, because it's something that people need. We may not be aware that people need transitional care homes to recover, to recuperate, and to go back their day to day. I think something that private healthcare should look at, because over here, private healthcare also pays for people to go to transitional homes after they are discharged. Once it's recommended for, it's not for everybody, but once it's recommended, the private healthcare will pay for at least 1 or 2 weeks for the person to go into these transitional homes to
absolutely
get better.
And some of these older folk are people who have worked all their lives, contributed to SNIT, etc. If, for instance, SNIT, as part of the arrangement, has put money aside to pay for that, right?
Yeah.
So that anybody who goes beyond, my dad, as an example, lucky guy, he, for some reason they said that he has to show that he's alive every year. So there's some type of process that he has to, go do at SNAIT to show. But once that is done, there's an arrangement for him to receive some whatever patents they give him. But if that money, some of that money, for instance, is paid to health insurance, geriatric health insurance, if there's anything like that, I'm just coining that phrase, right? So that older people will have a more quality, more quality life.
Yeah.
Please go ahead.
We the focus is quality of life. We want them to have enjoyed their retirement in good health.
Absolutely. So let's branch slightly into mental health, because you've already mentioned some of these factors that some of these what would you call them, symptoms, right, which come with old age. Now, most of these are likely to be misconstrued in Ghana, especially if you're female. In the northern part of Ghana, for instance, we have the witch camps, which there's a campaign to shut down. Everywhere else across Ghana, if you're female and you start exhibiting certain symptoms of certain diseases that in the West are well researched and known, you are likely to be taken for something else, a witch, something, right? Doc, how are we going to take care of this matter for our geriatric folk?
Yeah, we like, it's sad when you read stories like this, that someone who clearly has dementia is being mistaken for a witch and being stoned to death, or head being shaved off their head and all that. It's sad when you hear stories like that. So we have a lot of education to do. I don't know how I got into geriatrics, but maybe it was destiny. I think my dad, who was when I was around 10 years old, my dad was becoming forgetful, and he left home and we never found him again. Oh, no. So the recognition, I'm sure if someone had recognized that this man was becoming forgetful and was developing dementia, they would have prevented him from leaving.
Would have done more. That's right.
They would have done more. But he packed up his stuff and said he was traveling, and they allowed him to go, and we never found him. So education is key. We have to educate people that when people grow old, the statistics is that 50% of people over the age of 90 will develop dementia. It's not everyone. And as you grow older, so like between the ages of 75 and 85 is about 20 to 30% of people. And then at 90 is about 50%. So when they grow older, and we tend to have more females who are past the age of 65 in that demographic. So I'm not surprised that when they start becoming forgetful and hallucinating a bit, people think they are witch, and they mistreat them. But I think education has to go a long way to help the people. The other thing is people do get depressed, and in elderly patients, depression usually starts like irritability. They get annoyed at the least, and not provocation. Everything sort of annoys them. Everything irritates them. So that's how depression is sort of manifested in elderly patients. So they present differently, and it's up to us to educate people to know that these things are treatable, these things are manageable, and we have to educate the public about it.
Doc, now let's look at some of the complex diseases, if we can call them complex, or maybe even if they are simple, I don't know. But what are some of the even common diseases that mostly affect people in that demographic? And I'm talking about in our part of the world, because I know, for instance, that some diseases or some manifestations of some diseases may be more severe in some demographics than in others, right? And I'm even talking about geographical demographics here. But in Ghana, for instance, what are some of the common diseases that you have identified?
I mean, the common diseases are almost the same. I mean, hypertension, diabetes, but what happens is that they may be subject to develop the complications of those diseases. So they are more likely to develop strokes. They are more likely to develop heart attack, and the problems that are associated with these conditions, like congestive heart failure. So it's imperative that whilst we are younger, we manage these conditions aggressively. We treat our high blood pressures, we treat our high cholesterol, we treat our diabetes, so that even if we develop these complications, we wouldn't have physical disabilities from these conditions. Because if you develop a stroke and if you have a stroke and your one side of your body is paralyzed, it definitely affects your gait and mobility, and it will increase your risk of falls and injuries. So these are some of the things that can happen to these demographics too.
And what are some of the uncommon ones? Some of the ones that are not very common, but you have still identified in your 20 years of practice as a geriatric doctor?
I would say that they are there, but we may not appreciate it, like pain from arthritis that limits their mobility.
Yeah.
That also cause them to fall. Some may develop neuropathies, which is basically some pain sensation in the lower extremities that are complications of diabetes that also predispose them to falls. So arthritis is basically wear and tear. So that can manifest as pain and stiffness, and they may not associate it with, they may have the pain, but they don't think they need to be treated for it. So we have to recognize that these pain or stiffness need to be treated to improve their function and mobility.
Now, before we go, Doc, let's also talk about managing these conditions. In Ghana, we take the average person in Ghana, the average older person in Ghana who is experiencing any of these conditions. Let's say they have some support. Let's say they have a little money to go see a doctor. Let's say they have a little family support, averagely. What is your best advice for just before you get into that demographic, and once you get into that demographic and you start experiencing some of these symptoms? How do you manage those things?
So the key is preventive health or preventive medicine. So like I said, we have to have managed these conditions probably our whole lives, which means for these folks, we'll recommend that at least once a year they visit a doctor and get all their labs done. They may also need to see other specialties, like if they have they've had strokes before, they've had heart attacks before, they may want to see a cardiologist, or they may want to see a cardiologist or a neurologist. The other important thing is that, which I didn't touch, is the incidence of cataracts is very high in elderly patients. So they want to have their eyes checked at least once a year, so that when cataracts and glaucoma are picked up early, they can be managed. The cataract surgery is very, I won't say easy surgery because I don't do it, but it can be done within a day, and people can go home to their normal lives after the surgery. So the need to identify cataracts early and treat is also one thing. Sometimes there may be hearing impairment, and it could be as simple as earwax. So it's all part of the examination. They can be seen, look into their ears looked at, and wax cleaned to improve their hearing. If the hearing doesn't improve, they can be sent to ENT to see if there's anything else that they need to do. So the general physical exam at least once a year is important. Having their eyes checked at least once a year is also important. And having to see other specialties is also important. The other thing too that I will touch on is what we call polypharmacy. Just taking any medication at all. They have to always take medication that have been prescribed by their physicians.
I see, because there could be even like some medication that has been prescribed for them could be affected by something else that they're taking that has not been prescribed for them, right?
Exactly. And a common example is some like Benadryl. Some people take it for sleep, but actually it causes a lot of confusion in elderly patients. So it's something that we'll always tell them not to be taken. If you need something for sleep, we can always prescribe a more safer medication for sleep. But
it's not C2, is it?
Is that what?
It's not C2.
No, it's not C2. It's over the counter. So you can always get it. But it helps people sleep. But the downside is that it can cause a lot of confusion and other undesirable effects in elderly patients. So we always frown on that.
I see. Dr. Benyeboa, thank you very, very, very much for checking in with us today, for making time of your busy schedule to speak with us. As I said, we'll come back to you every now and then to get back to this subject, same subject. We'll be speaking about it every time because I feel like in Ghana, we don't have enough protection for the demographic that we're talking about, especially when it comes to health. And if we're going to improve the quality of life for our people, it has to be mostly for older people and for younger people, right? So that those in the middle can help sustain both ends of it. Because guess what? We have passed through there and we're going there. So, it only makes sense, doesn't it?
And we definitely need the government to
do their part. Please speak on that for me as we wrap up.
And invest in that. So they are the cradle of our society, and we have to treat and respect them.
It is, after all, part of our culture, isn't it? We respect our elders.
Exactly.
So we can't just give them lip service respect. We have to provide the things for them that will make them enjoy life. Doc, before we go, please, you also mentioned incontinence at some point, right?
Yes.
How common is that? And what's your best advice for people in that demographic dealing with that situation? Of course, they have to see their doctor and all of that, but
it's one of those things that people will not volunteer to tell you. They won't volunteer, but you have to ask and probe. But people in that demographics are prone to that, especially females who are obviously postmenopausal and may have had 2 or 3 vaginal births, are usually at risk of that. And in males, the commonest cause is prostate problems, can be the cause of urinary incontinence. So they have to volunteer that information, which is not easy, but we always probe and then refer them to the appropriate specialties to help them manage.
We seem to have lost Dr. Benyeboa.
I'm here.
Oh, yes. Okay. All right. We have him right there. Sorry about that. We had a little trip over there. Please go on, Doc.
So, yes. So it's something that people will not volunteer, but we have to probe and recognize that this problem is there and refer them to the appropriate specialties to deal with it.
Dr. Benyeboa, one more time, thank you very much. My best regards to the family. And are you going to the Pescoba event? Where is it this year? In New Jersey? Maryland?
They said Maryland.
Maryland,
So
yeah,
we'll
yeah,
see.
we'll see. Hopefully, Caliber, Texas, to Maryland, they're quite what New York, Bianca, Bufa, anyway, see you.
Well, the Texas was I heard it was unanimously voted for. So I don't know how it happened. Maybe it was due to some euphoria that I can't explain. But
I think next one should be in Texas. Then some of us too can stay home and then. So we
hey,
fly
once you give us a
and
direct
all
flight
that.
from Connecticut, we'll come to Texas.
I hope so. I definitely hope so. Doc, thank you so much.
Thank you for having me.
Every time. Thank you
All
very
right.
much.
Okay then. Bye.